Hello, my name is Alan Prost, and today we're talking about Part 3, the DLCO, or the carbon monoxide uptake test. What this does is determines the ability of the patient alveolar capillary membrane to uptake oxygen. So it's a pulmonary function test. And like with all of our pulmonary function tests, it's really important to get good coaching to get the maximal results and the most reproducible results with our patients. So, like all PFT tests, it's important to wear your nose clips. Make sure that all the gases that your patient's breathing in and out go through the filter and the device. And with this particular test, like all PFT tests, it's important not to obstruct the airway. So we want your teeth around the outside, getting a good seal with your lips, and breathing all your gases through the device. Okay? Now, for this particular test, the way it's going to work is that your patient will be breathing nice and gently for about 4 or 5 breaths. It can be a few more, but not less. And we want to establish a good baseline of FRC. So nice, easy breathing. And then the patient blows all their air out of their lungs as much as they can. So blow, 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 get it all the way down to residual volume, as close to that as they can. And then a big breath in, as big as they possibly can. Big, 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 big breath in to about 85% of their slow vital capacity or forced vital capacity. We'll get them to about 85%, and they'll hold it for 12 seconds. All right? So that's a long time to hold it. So let me repeat the instructions for that again. Nice, easy breathing to establish baseline. So we need about 4 or 5 breaths of that. All right? Then we're going to blow all the air out of the lungs, get down to residual volume, blow, 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 and then big breath in as much as you possibly can. Big, big, big breath in, big, 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 holding it for about 12 seconds. Count it down for the patient, holding it, and then blowing it all out. Now, one of the tricks of this test is when you take that big breath in, you're not going to be breathing just regular gas. It's going to be a gas mixture from the device. So the patient's going to sense that and should be warned prior. All right? It's going to be a bit dry and feeling a little unusual. One of the other unusual aspects about this test is when you take that big breath in, you have to hold your lungs open. All right? So when you take that big breath in, and holding your glottis open and holding your lungs distended, you can't relax and start to exhale at all. You got to hold that open for 12 seconds, and that's going to seem like a really long time. So we're going to have to coach our patient to hold it, keep that breath, keep that breath, keep that breath for 12 seconds, and then exhale, and that'll be the end of the test. All right? So let's see what that looks like on our patient.
So now let's see what this looks like on our patient. So we get him to initially breathe nice and relaxed on the device to get a good baseline. So nice, easy breathing. We need about 4 or 5 background breaths. Nice, easy breathing. Okay, now initially we're going to blow it all out. Blow, 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 blow. Keep blowing, keep blowing, keep blowing, keep blowing. And now big breath in as much as you can. Big, big breath in. Hold it. Keep it in, keep it in, keep it in. Hold it. 4 more seconds. 3, 2, 1, and exhale. And that's the end of test. So for the DLCO, we need at least 2 acceptable tests, and that means that they've had a good baseline established, good full exhalation to residual volume, a good maximal inspiration to about 85% of vital capacity, and that's held for at least 12 seconds with the inspired gas, and we need 2 good tests. So we get our 2 tests and we look at the DLCO results, and we look at our maximum and minimum, and they should be within 3 millimeters of carbon monoxide. The DLCO should be within 3 millimeters of mercury difference between them, and so this meets our criteria because it's less than that. And also we're going to report the average of our 2 tests because we're not sure which one's correct. So that's the way we would report the DLCO, is the average of 2 tests. So that was our very brief introduction to the single breath carbon monoxide uptake, or the DLCO test, which determines the functionality of the alveolar capillary membrane of our patients. I'm Alan Prost. Thank you very much.